What is malnutrition? Malnutrition occurs when the body does not get the right balance of nutrients and calories that is needed to stay healthy. This does not just happen to people who suffer from hunger or who do not have access to healthy food. Malnutrition can happen to anyone, including your children with autism spectrum disorder. Malnutrition can be divided into undernutrition and overnutrition. Undernutrition occurs when there is lack of calories, protein or other nutrients and vitamins, whereas overnutrition is defined as excessive of calories intake. So, what is the risk that can lead ASD kids towards malnutrition? ASD kids can be extremely selective when it comes to eating. Their eating habits can be influenced by texture, feels, smells, and taste of the food items. The refusal rates are significantly higher in children with autism spectrum disorder compared to without. So, what types of food do ASD kids prefer? There is significant research that suggests a majority of ASD kids prefer food with a similar texture, be it all soft or hard or crunchy. Eating habits are variable in autism, but the most common ones experienced are repetitive behavior of eating the same food item every day at the same time. Some children will only consume food of one color and express an extreme repulsion towards the new food item. So, what are the consequences for being picky eaters in ASD kids? Gastrointestinal dysfunction are the term used to refer to any conditions or disease that occurs within the gastrointestinal tract. GI dysfunction can give the signs and symptoms of bloating, abdominal pain, constipation, and diarrhea. GI dysfunction can affect the ASD kids with sleep disturbance, aggression, anxiety, and grimacing to express their discomfort. Low fiber diet is one of the reasons for GI dysfunction in ASD kids. Fiber can be found in vegetables, fruits, whole grains, and legumes. Fiber is important in bowel health and in children's diets because it increases the rate and the size of the stools and softens it, which may decrease the chances of constipation of your kids. Inadequate intake of water also can lead to GI dysfunction, as water is known to aid your digestive system by helping break down food, assisting the GI to absorb nutrients faster and more effectively. Lastly, eating a lot of dairy food can increase the risk of GI dysfunction because it usually contains more fats and proteins which are difficult to digest. Obesity is a medical condition involving excessive fat accumulation that presents a negative effect on health. In some conditions, some children with ASD will overloading their mouth with food, which lead to bigger food intake in children with ASD. Serious concerns have been associated by the frequent intake of energy-dense foods such as fast food, soft drinks, sweets and jellies, which known as empty calories food that can result in excessive energy intake but very low in nutrient. Since children with ASD usually will eat their preferred food, this may lead to obesity if the food choices are belonging under empty calories food. Obesity puts our children at higher risk of developing osteoarthritis, cardiovascular disease, type 2 diabetes, and cancer. In conclusion, malnutrition in children, especially young children, may lead to developmental delays and more sickness because of poor immune function, and high nutritional requirements are needed for growth and development. Improving eating habits in children can be a difficult and draining task. It may take months or years to change their habits. Thus, it is important to keep persisting. So, stay tuned for the next activity to explore and get some tips in order to help your children to eat healthy.